Thanks so much, Patricia. Yeah, and welcome everybody to our last Catalyst seminar of the year, which is focused, as Patricia said, on youth justice, which feels like a really important topic because there is a lot of mental health challenges within youth justice and forensic settings, and we're going to have two fantastic talks today around that topic, with the first focusing on special educational needs and youth justice. And the second focusing on what we can learn from evaluations in forensic settings for children. And we have three colleagues with us today to talk through that work. The first is Dr. Susan Castro-Kemp, and she is an associate professor in psychology and education at IOE, and also director of the UCL Centre of Inclusive Education. And her research focuses specifically on SEND in education, and particularly inclusion in education settings as well. So welcome, Susana. And Susana's going to give her first talk, the first talk of the day shortly. Also welcome Anoushka Kapoor, who is a research officer at the Child Outcomes Research Consortium. Before that, she was also a researcher at Anna Freud, which is children's mental health charity, in which Cork now sits. And before that, Anoushka was working more clinically as an assistant psychologist in a mental health support team. And she has particular expertise around qualitative and quantitative methods and co-production in research with young people. And finally, we also have Professor Julian Edbrooke-Childs, who is a professor of evidence-based child and adolescent mental health, and also co-director of the evidence-based practice units, which is a collaboration between UCL and Anna Freud. And Julian's research focuses on empowering young people to manage mental health and mental health support, with a particular focus on inequalities. So welcome to you all. We're really looking forward to hearing from you. But to start with, Susana, I will pass over to you to give our first talk. Welcome and thank you.
Thank you very much for the introduction and for the invite to be here today. It really is a pleasure. Let me just see if I can share my slides appropriately. There you go. Can anybody see that?
Yes.
Brilliant. Thank you. Okay, so I am going to talk to you today about about two projects really, but mainly about one project that I collaborated with other colleagues, and it was commissioned by the Michael C. Foundation. It has to do with special educational needs and disabilities, or SEND, as we say in the English policy terminology, and youth justice. So the work of this project was commissioned by the Michael C. Foundation. I co-authored it with Professor Cheryl Thomas from UCL Law, who was the chair of that working group, and she is the specialist in justice and law. So if there's anything more specific about that and you would like to know more about, then she is definitely the person that you should talk to. And then Kate Aubrey-Johnson, who is a barrister, Sir Robert Buckland, who is a former MP, and you may know him because of the famous Buckland review around autism and employability. And also Anna Marie Day from Manchester Met, and Frank Grimsey-Jones from Exeter University. So I'm going to focus the presentation mainly on this work that we've done with the Michael C. Foundation, but also I will talk a little bit at the end about some insight that we are gathering from my current grant, which I am leading, funded by the Nuffield Foundation, who provides some more practical recommendation, which provides more practical recommendations around how to implement some of the recommendations issued in the first study. So hopefully it will all make more sense at the end. So just to give you a little bit of an overview of the policy landscape of the youth justice system and SEND in that context, to set the scene for the work that was done. We know that each year over 100,000 children under 18 have encounters with the criminal justice system, and almost 59,000 are arrested. We know that in recent years we have seen huge increases in stop and search of children, arrests of children, and children as first-time entrants to the youth justice system. And we also know that the proportion of children in custody is now at a record high. There was last year, or the year before actually, there was a report from the Ministry of Justice that received quite a lot of attention, where it was stated that around 80% of children in the criminal justice system have some form of special educational needs and neurodivergence. Obviously, this percentage is very, very high, and for that reason, it received a lot of attention from the media, from policymakers, and it very much triggered the Michael C. Foundation to commission this work, as they do a lot of work in the youth justice field. However, to be honest, I'm not surprised with this statistic, and we would almost be tempted to say, and as a result of the work that we did with this group, we can certainly say that almost all children in the criminal justice system will have some form of special educational needs and neurodivergence. Many of these children will not have been assessed or diagnosed, and they might not even meet the specific criteria for a diagnosis by the time they have their first encounter with the youth justice system. And we also know, and that, we knew this initially as a working group when we got together to work on this, but then we also found this in the results of our work, that key professionals operating within the youth justice system are simply not sufficiently trained to deal with this particular cohort. So the Michael C. Foundation, as I said, they are a charity in London that has links with policymakers and does a lot of work and lobbying around youth justice and special educational needs more recently. And so based on this current landscape, they became interested in how to deal with cases currently in the youth justice system involving SEND and neurodivergence, and how to do that more appropriately and effectively. But also, we wanted to try and understand changes that can be made within the criminal justice system and services to meet the needs of children with SEND without needing to have primary legislation developed or changed, because that's very time consuming and expensive. And also how to maximize public safety by increasing the likelihood that children with SEND and neurodivergence who commit crimes go on to become well-functioning, law-abiding adults, and also how to best coordinate the different departments responsible for children in all the different public bodies. So to do that, we got together a working group made of the people that I've mentioned before. My role in the working group was mostly to contribute with the education side of things. So I'm an expert in special educational needs and inclusion, and so I'm not an expert in youth justice or justice at all. And actually, I've learned a lot from this experience. So what we did was we triangulated information from a number of different sources. We conducted a rapid literature review in the field, but we also issued a call for evidence, and that was hosted by the Michael C. Foundation. We received oral evidence, but we also received written evidence on these specific areas of focus that we had to find for the working group. Then we produced a thematic analysis of the transcripts from the oral evidence, but also on the written evidence received. And we then produced an economic evaluation, and that was the contribution of Frank Grimsey-Jones from Exeter. The link for the full report is here, and I can actually I can copy it and paste it on the chat when I finish my talk. I can't do it now all at the same time, but I will do it after, and I'm also happy to share the slides if you want to access the full report, because I can't share in detail all of the findings. It's just very extensive, so I had to make a selection for this presentation. We did have a number of different evidence givers from different stakeholder groups. We had academics, justice consultants, social workers, third sector, members of the House of Lords, judges and retired judges, magistrates, youth justice system, Crown prosecution representatives. So it was very, very broad, and people with a huge amount of experience in this area. So it was very useful in that respect. I think we definitely got the evidence from the right sources. Um, when it came to analyzing the findings, we highlighted three main areas of focus that we think our evidence givers focused on across transcripts. We have findings about the period for children prior to entering the youth justice system, and that's related to the education experience. So that's where I contributed the most. We have findings around the point of entry in the youth justice system and during contact with the youth justice system, and then findings around the point of exit and the future for those children. And I'm going to cover very briefly, as I said, a selection of findings in each one of these three themes. So prior to entering the youth justice system, which is very much the prevention side of things, what we found from our evidence givers and our literature review is very much aligned with what we know from the literature in this area, is that children with SEND and neurodivergence are much more likely to be excluded from school, which makes them at a higher risk of becoming victims and perpetrators of crime. And actually, the Timpson review on school exclusions years ago has highlighted precisely that, and has highlighted as well what we found from our evidence givers, that early identification of SEND and neurodivergence is absolutely crucial here for preventative work. However, as we know, this is often not there, or it is very inadequate. We also heard that family support can be absolutely crucial in mitigating the risks of offending. However, families often don't have the capital, the various forms of capital to support their children effectively. And we also heard that the co-location of support services can be absolutely essential, but again, often isn't there. And so there needs to be a lot more interdepartmental communication with an emphasis on early intervention prior to contact with the youth justice system. And I just wanted to highlight some of the quotes that there are many in the report that are quite striking, but I've just made a selection of some of the most powerful ones, in my opinion. Resource-stripped services are tightening their criteria to the point where that earliest possible intervention is just non-existence. We're now in a situation where the lid is on everything to try to keep difficult and troubled and challenging children under some notion of control. I don't know how you wind back from that to a position where everybody's trained in restorative practice or solution finding or family at the table or group conferencing. So suggesting that the change that needs to be implemented now needs to be quite substantial and across the board, really. Here's another one. They are the boys predominantly who haven't got a diagnosis, who have unidentified need. And everyone is scratching their heads going, how come we're here? There was a stable home environment. School was a bit bumpy. They maybe missed a bit of school. There were a few exclusions, but they've not had any assessment of their needs. A lot of parents that I talk to at the initial stages, after having difficulties at primary school and then getting into secondary school and having difficulties, will say to me after an EHCP has been issued that their two worries were either their child would be dead or their child will be in prison. I think that's incredibly powerful. We also heard about teachers being underprepared for spotting a child who is struggling to engage with the written word, the spoken word. And actually, we know from research in the SEND area that children with socio-emotional and mental health difficulties often have speech, language, and communication needs as well. And so that should be a very clear indicator that needs need to be addressed in a more individualized and targeted way. And we heard that interventions such as early screening for neurodisabilities, mentoring, family therapy, and liaison programs linking families with appropriate support have been found to be effective in many countries in helping families under pressure to cope. And I will come back to this when I talk to you very briefly about my other research, where we're looking at international evidence on what works for SEND preventatively. So the recommendations in terms of this particular phase, which is prior to entering the youth justice system, have to do with compulsory training in SEND and neurodivergence in education to help improve early identification. Of course, in the scope of the solving the SEND crisis inquiry and all the changes that are going on at the moment in the policy landscape for SEND, we know that likely this is something that will be looked at by the government as they prepare to issue the white paper. And we also have some evidence that is emerging from our international research about what training should look like in education for SEND and neurodivergence. So I'll get back to this again later on towards the end of the presentation. And the second recommendation is the creation of an independent reviewer of youth justice. So someone who would be accountable for reporting on how well the different agencies are working together to monitor child's needs identification and support allocation, including the courts and the tribunals, because often we just talk about education, health, and social care, and often we leave the tribunals and the courts behind. Now we enter the second phase or the second set of findings, which have to do with the point of entry and during contact with the youth justice system. And we heard that the criminal justice system retains a number of outdated features that are actually harmful to children, particularly those with SEND, which, as we know, are almost all of them, if not all of them. There is no universal screening system for neurodivergence among children in the justice system, which really seems extraordinary, and there is an urgent need to address this. There is a clear lack of understanding of neurodivergence amongst professionals in the youth justice system, including police and legal representatives, who are the first people that these children encounter and who they talk to once they get into contact with the youth justice system. But also, as they move into the youth justice system, the court processes are also not well adapted to improve the participation of children with SEND and neurodivergence. Judges often do not have sufficient specialized training in SEND. There is some training, as I hear, but this training is definitely not enough, and it's definitely not up to date, and it's definitely not specialized enough to ensure proper plans are in place for any children sentenced. We heard that actually courts and the courts in general can judge children with SEND and neurodivergence more harshly. And we know that the secure estate does not currently have a comprehensive approach to neurodivergent children. So we have these children in the secure estate where there is absolutely no adaptation to any of the needs that we know that they have. So here's just again a couple of quotes to illustrate this. In truth, a radical new system, which is cross-cutting and providing early intervention and support for the most vulnerable, such as children in care and those who are permanently excluded from schools, would be the only way to ensure effective and deliverable outcomes. And again, this emphasis on multi-agency work across departments, including the third sector, for effective sharing of information and better intelligence. We heard that assessments and initial interviews in youth justice services can place a responsibility on children to participate actively and positively, which again can present issues for neurodivergent children, particularly those with communication challenges, which, as we know, are the majority of them. Some officers feel that not only do they need an admission of guilt, but they need remorse as well in order to divert. And so there is a sticking point there that takes them into an adversarial process with children that likely will have enormous challenges in doing any of these things. Um, it was abundantly clear to me that the children who were coming before the courts were being traumatized. And here I speak about all of them, not just the children who offend, not just the victims, but also the witnesses. That's why we recognize that everybody who walks in through the front door of a courthouse is experiencing some degree of trauma. And this is true. And if we think that we're not doing better, at least for children, then this is something really radical, as we heard, needs to happen. So some of the selected recommendations, as again, there are many more, but some of the selected recommendations in the report include mandatory screening for child suspects for SEND and or neurodivergence at police stations. And my colleagues who know more about this than me suggest that there isn't at the moment a off-the-shelf tool that would do this adequately, but there are starting points that we could use to develop an appropriate assessment. We also need compulsory training in SEND and neurodivergence in children for police and legal representatives who engage with children in the youth justice system. Intermediaries to be present during police interview, which is incredible that this hasn't become mandatory so far, but it hasn't, and this is one of the recommendations that we made, and improved conditions of custody at police stations. And then lastly, at the point of exit, so the last set of findings, we know that children who are then sentenced to custody are then assessed with a comprehensive health assessment tool for health needs. But what we also heard is that after this assessment, nothing happens. There is no adaptation of need. We also don't know if this assessment is the best possible, and likely it isn't. But even though the assessment is there, that doesn't mean that there's any change after the assessment. Again, we know that multi-agency collaboration can be key for successful reintegration and to lower rates of recidivism, but this is not happening. From what we hear from our evidence givers, we also heard that there is very little research on pathways to desistance for SEND and neurodivergent children who commit crime. But we know that reoffending rates are significantly higher among children with a developmental language disorder than for children without a developmental language disorder. So this means that interventions targeting SEND and neurodivergence, meeting the needs of these children, having a greater likelihood of reducing reoffending, which would be very helpful because we know that reoffending accounts for about 50% of youth offending. And our cost-benefit analysis, which is a lot more extensive than this, and you can read it in the report, but I think this is an interesting point to add here and relevant. Reducing child reoffending rates by 10% only would have an economic and social benefit of 74 million to 217 million. So the recommendations at the point of exit would be to have that same independent reviewer of youth justice charged with conducting an annual review of multi-agency work. So the same accountable individual or agency or body that oversees multi-agency work at the point of entry, at the point of contact with the youth justice system, would do the same as well at the point of exit. And then some other findings across all stages. We heard that the United Nations on the Rights of the Child Convention and Committee urges states to systematically collect disaggregated data and recommends regular evaluations on the effectiveness of the measures taken in relation to discrimination, reintegration, and patterns of offending. But data on the incidence of SEND in the youth justice system is lacking a lot of very important detail. And actually, there is a lack of consistent and recent data from the UK enabling tracking of educational pathways of children who become offenders. And so the recommendation is that there is a cross-sector work in terms of data management and annual reporting of that, including disaggregation by diagnosis, type of need, EHCP status, etc. So, as I said, these were some of the recommendations of that report. The interesting thing about this report is that there was a parliamentary launch where several ministers attended. We know that several ministers are looking at it. It was cited in a hearing in the House of Lords, which led to some suggested amendments to the Children's Wellbeing in Schools Bill, which haven't happened yet, but may be considered. And we also think it's, from my point of view, because I work with the DFE quite a lot and with the education sector, and I'm involved to an extent in informing some of the changes that are happening in the SEND policy landscape. It is the right time to be actioning some of these recommendations, because if we need a radical new system that will change SEND, hopefully for the better, then this is the time to change all other sectors that should be working together with the education system as well. As I said earlier, I have another project that provided some insight into this report in the area of education and prevention. The Scope Send is a project funded by the Nuffield Foundation, where we are reviewing the SEND policy and implementation in 14 jurisdictions around the world. So it's a very unique review, never done before in this way, where we are triangulating a number of different methods with this idea that policy analysis is only complete once you look at the policies, which is the input, the processes that they trigger, and then the output. So how stakeholders actually perceive policy implementation in all jurisdictions. And what we're trying to do is, even though we understand and we recognize that context is very important and policy will be different in every context because of contextual idiosyncrasies, we also recognize that and we are starting to observe that it is possible to establish links between certain elements of policy and more positive experiences of the system by the end users. And so those are the links and the patterns that we want to bring to learn lessons from and to inform policy change in England. Hopefully, we have given oral evidence to the House of Commons Education Select Committee solving the SEND crisis about this, and many of the recommendations of the Scope SEND project, which isn't finished yet, but many of the early recommendations fed into the Michael Seif report as well. So very briefly, I can also put the link to this project, which has now two preliminary reports available for anyone to read. I can put the link on the chat so you can access the full reports. But just as a summary of the things that we have been recommending, we have recommended that the first thing we need to do, the most important thing we need to do to get the SEND system in the right direction, is to getting the needs assessment right, independent of diagnosis. And this is obviously not to say that diagnosis is not important. Diagnosis is very important for a variety of reasons, and I could name various. But what happens is that for a very large group of children, they will not meet the diagnostic criteria. They will have overlapping needs, or they are too young to meet those criteria, and they still have needs that need to be supported. And so we need to get an assessment of needs that looks at the everyday life participation needs of the children, even if a formal diagnosis isn't there. And we saw from other countries that early childhood intervention can actually be really useful when it's established at a country level to identify those needs from the beginning, and then it's much easier to carry on with that screening throughout other phases of education. Obviously, there's a lot more detail about how and the processes that by which this can be done in the reports, but I'm just giving you an overview here. We also heard that where in countries where cross-departmental work works better are those where they have a more solidly implemented early childhood intervention system, because that's how early childhood intervention works. You have to work with different agents, and so the system is already there and it continues across other phases of education as well. Professional development is important, and everybody talks about that. And the recommendations of the Michael Seif report do recommend that. However, it's important that not all professional development is useful. It's important to know that. So what we found from looking at other jurisdictions is that those where professional development for teachers and educators, where that is embedded, not top down, not one-off workshops, more based on inclusive practice overall and based on peer-to-peer discussions and almost like supervision encounters locally based, is a lot more effective. And we also found that those jurisdictions where the policy documents themselves adopt a language and a narrative that is more inclusive, that will promote a more inclusive view of schooling in the systems themselves, and it's linked to more positive experiences of the SENS system. So we're talking about jurisdictions where the terms belonging, well-being, inclusion, peer support, diversity, where this kind of tone and sentiment is present in the policy, there are actually more reports of positive experiences, more comprehensive reports of positive experiences of the SENS system. And so from my point of view, with all the work that I have been doing across projects, this is the right time to take on board these recommendations and promote change that is cross-sector. I think this is all from me today. Thank you very much, and I'll be happy to answer any questions at the end.
Thanks so much, Susana. There's a lot to think about there, and I think we're all despairing a bit of why some of those things aren't already a priority, given the populations we're talking about within youth justice settings. So, so many young people with special educational needs and disabilities are overrepresented there. Thank you. Yes, and we will take questions right at the end. So if people don't want to lose sight of their question and want to pop it in the chat now, that's absolutely fine, and I can come back to it later, but you will have a chance to ask questions at the end too. But we'll move on because I'm conscious we're a little behind time. But Anoushka, it would be great to come to you and hear more about the learning from your evaluations in forensic settings. So over to you.
Thanks, Jess. I'll just start sharing my slides. Okay, just bear with me. Okay, can you see my slides and not my notes, hopefully?
Yes, just
Perfect.
the slides.
Thanks. Thank you, Susana. What an interesting talk, and definitely linked to some of the things that I'll be talking about today as well. So thanks, everyone. My name is Anoushka. I'm one of the researchers, part of the Child Outcomes Research Consortium team, as Jess mentioned. And today I'm very excited to be sharing some learnings from two of the mixed methods evaluation in forensic settings from the evidence-based practice unit. So before I talk about our evaluation and before I introduce what these two projects that we evaluated were, we thought it would be interesting if we gave you some context about what policies underpinned these programs that I'm going to talk about. So just for some background, these evaluations were published about 3 to 4 years ago, and they're both underpinned by policies and evidence coming out around that time that said that there really needs to be a focus on improving the mental health and care for children and young people, with a focus specifically on supporting children and young people that are presenting with a high risk of harm to self or others, due to research suggesting that they are more vulnerable to mental health difficulties as compared to the general population. And there was also a lot of evidence coming out around how we need to focus on taking a whole child and whole family approach, focusing on early intervention and promotion of good mental health from early ages, which required a fundamental shift in the way of working and the culture, which made me think of what Susana mentioned about how one of the quotes that she mentioned was around how there needs to be a radical change in the way of thinking. So these were some of the policies that were coming around that led to these two projects. And these two projects were the Framework for Integrated Care, Secure Stairs, and Community Forensic Child and Adolescent Mental Health Services, the CAMHS project. So the framework for integrated care Secure Stairs, it intended to improve the quality of care and outcomes for children and young people in secure estates. And the community FCAMS was targeted towards children and young people with complex and high-risk presentations that were beyond the traditional Tier 3 remit. And while the framework for integrated care promoted consistent, trauma-informed, formulation-driven, evidence-based care, which was delivered within a whole systems approach, Community FCAMS was created to support the network around children and young people who presented as high risk of harm to self or others, or who were in contact with the youth justice system. And this was in response to literature which suggested children and young people accessing these services present with higher needs and are more vulnerable to victimization. So the aim of this slide is to give you an overview of these two projects. And as you can see, while they are distinct, there's very much lots of overlap, especially in who they seek to support, the ways in which they seek to support these children and young people, and also why they have come about, what literature are they responding to. So our evaluations, which evaluated these two projects, we had two primary aims. We wanted to examine the implementation of this way of working to see how far along services are in their embedding of these programs, to see if it's leading to improved understanding, and also to assess the impact of implementation. So we very much wanted to see what's the experience and outcomes of those involved in these services. What are the staff who are delivering these programs? What do they make of it? What are the children and young people and parents and carers who receive this support? What has their experience been like? What are the characteristics of children and young people and families that are being supported? So that was our second aim. In terms of the methodologies, so both of these were mixed methods, realist evaluations. We collected some quantitative data from the sites that took part, and we also collected some qualitative data via interviews, focus groups, and case studies. And today we'll be focusing primarily on the qualitative findings, although you can find both reports on the Anna Freud website, and you can read more about the quantitative findings as well if that interests you. So I'm going to move on to talking about some broad findings from these two evaluations, and to make it interesting and so that we can hold these two evaluations together, we've grouped together some common themes across both evaluations. So the first one that we wanted to share was around the impact on children and young people and their families. So what was the impact for people who received support from the framework for integrated care, Secure Stairs, and the community FCAMS services? So we found that the support offered was of high quality, it was non-judgmental, it focused on good communication between the staff and the families, and it was very tailored to what the family needs, which is something that they might not have experienced before. We found that needs were being met, difficulties were being identified quickly, and they were being addressed on time. And there was also a development of mutual trust and respect between the staff and the children and the young people. And this had led to them encouraging children and young people to manage challenging emotions and behaviors, which then in turn improved their capacity for self-regulation. And I think the quote on the screen illustrates that really well. So here we have a child or a young person who was reflecting on how when they're making a bad decision or when they're getting into a fight, they think back to when a staff member had spoken to them about the consequences of their action, and then they were encouraged to think about how to not engage in this particular behavior, or what might happen if they did engage in this behavior. So that's to give you an overview of the impact. And within this, we really wanted to pull out the amplification of children and young people's voices throughout these two evaluations. And this was a common finding that stood out to us. We found that children were feeling listened to and understood, and staff really wanted to know them for who they are rather than their needs or their past behavior. And as you can imagine, given this cohort, this was quite an important finding, especially when you think about the fact that these children and young people were exhibiting high behavior, and so the network around them really needed to be sort of supported in maintaining safeguarding concerns. So we thought this was an interesting finding that we wanted to really highlight today. We found that, as I said in the slide before as well, families were being understood in a way that they had not been understood before, and this really helped promote a sense of receiving very individualized support. And the multi-agency and co-produced way of working increased staff's understanding about children and young people and their story in their own words, This prevented re-traumatization, and it also empowered the children and young people when they felt like their voice was being heard and given a platform. And so, in turn, children and young people reported that staff better understood them and they understood what they were feeling and also why they were feeling that way. And the quote that illustrates this is from a parent who shared how the staff is joining the dots and they're not only bringing a knowledgeable and clinical perspective to their needs, but they're also understanding them in a very holistic way. And as they go on to say, this is something that they don't really have much experience with, services taking the time to understand them in this way. So we've thought a bit about what the impact and the experience of children and young people and families was. And then I wanted to discuss the impact on staff. So interestingly, the increased understanding of children and young people's problems is not just something that was reported by children and young people. This is also something that staff said. They said that they're understanding children and young people better, and this has acted as a foundation for trauma-informed, developmentally attuned, and the psychological-based change in culture and practices, which is quite interesting to note if you think back to the earlier slide around what policies underpinned these programs coming into existence, and it very much was a need for this change in culture. So this is interesting to observe. And a change in culture was also observed in the form of because of the fact that staff were provided with training, supervision, a space for reflective practice, and opportunities for multi-agency working. And these kinds of things resulted in staff feeling more valued and empowered in their roles, which then in turn increased their well-being. Staff also reported more confidence in managing complex and high-risk cases, and all of these things led to staff feeling more enthusiastic. And we also found evidence for improvements in staff retention. And as we'll see by the quote on the screen, a staff member reported how they're feeling like they have a better understanding of the young person's background and also how that background then goes on to impact resulting behaviors. So there's lots of really interesting positive things that I have discussed today, but as you can imagine with any implementation, there were some facilitators, but there were also some barriers that we observed. So first of all, we saw that services are not reaching every single child and young person who needs this kind of help. And although it is unlikely that this will be 100% achievable, approaches to increasing the reach of such services should be considered. And one way that this can be done is by ongoing engagement with stakeholders, especially partners in education, social care, and youth offending teams. All of these things can help increase reach and also inclusivity, and it can help ensure that children and young people who are most in need but often least visible to the system can also be supported. Excuse me. Another barrier that we observed was lack of senior leadership in implementing change can act as a barrier in implementation. And I think the quote on the screen really illustrates that. So somebody is sharing how when leadership at the top doesn't show this commitment to and this investment in this way of working, then this trickles down to staff, and that change in culture really gets lost because if your institution doesn't believe in it, you might think, why are we doing this on the ground? Should we not just go back to doing things the way that they were? So we found that senior leadership, consistent leadership, and positive relationships between leaders across agencies, it was described as being very crucial in establishing and also modeling culture change. So those were that was a brief overview of some interesting findings that we had. And looking ahead to some other similar evaluations that we have undertaken since then, given that these were a couple of years ago, we have taken, I can speak about 2 evaluations that are also underpinned by the framework for integrated care. So the first is the London Vanguard Independent Evaluation, in which we're evaluating a community-based holistic model of care, which supports the needs of children, young people, and their parents and carers by actively engaging with local communities. And it builds on existing services and infrastructures. It plugs gaps in expertise and capacity as is required. And the focus is on supporting children and young people who are involved in youth violence or who are at risk of being involved in youth violence. And this is an evaluation that we are currently just wrapping up. We're in the final stages of it. So hopefully you'll be able to see some of our findings coming out from this maybe in the near future. And another similar evaluation that we have recently wrapped up is the Humber and North Yorkshire Children and Young People's Trauma-Informed Care program in which different organizations from health and care, youth justice, and education and voluntary sectors are formally collaborating to provide health and care services to improve outcomes for children and young people involved in or at risk of being involved in the youth justice system. So again, this will be one to look out for. Maybe in the new year, you might find the findings on our website. But I think that's all that we had to share today. And I believe we'll be taking questions at the end, Jess. So I'll just wrap up there and say thank you on behalf of Julian and I.
Thanks so much, Anoushka. Yeah, I think we'll go to questions in a tick. It's really interesting across the two talks, seeing so many common themes coming up when they're being approached from quite different angles. I mean, I certainly got early identification being crucial, came out from both. Support for families so that they can better to support their children, centering the young person and really seeing them as a whole young person came out from both. The importance of training, completely appreciates sort of the right training and development for staff being really crucial. And that cross-agency working, because this cuts across so many different domains and priorities, doesn't it? But I'm sure there are more than that, but they really came up to me. Right, well, we should let others ask questions. So it would be great if anyone has questions for Susana, Anoushka, or Julian, please do either write them in the chat or pop your hands up, and I'll keep an eye on hands coming up from the audience. I mean, maybe I can kick off with one, which probably is to both of you. So maybe Susana first, but and I feel like this is a mean one to start with, but I do wonder. I mean, I was sort of taken, Susana, by what you were saying about. I think I sort of read it as when we've got resource-strapped systems, quite often we fall back to a position that is less than ideal, and that becomes a more draconian position. And how much do you think this is a question of just more resource being needed or being smarter with what we've got? I mean, I suppose we can always ask for more, but yeah, it'd be great to hear your thoughts on it. Is that the root of the issue, or have we got more to challenge and tackle here?
That's a great question, and I've had that question numerous times, including in the work that we do with the DFE and policymakers. From a research point of view, what I can say is that we have seen in other jurisdictions with far fewer resources as systems, education systems, a lot better work being done in terms of inclusion and early intervention. So it does seem that just giving more money, allocating more money, throwing money at the problem alone might not be a solution. And it certainly has to do with being very strategic in the policy regulations that are implemented. We also, well, obviously the Michael Seif report also has some costed recommendations, and there are some things that could save just so much money that could be reinvested back into the education system that are really very simple things to do. You know, to just to set up local multi-agency teams with accountability powers working together with Ofsted, for example, and then a national cross-departmental team that would oversee those to ensure that the different agencies are communicating with each other. Just that would very likely, very quickly have an effect on prevention that we would see translated into an economic benefit that would then be fed into the education system again. Obviously, this is all very complex and it's hypothetical, but it's based on evidence that we see from other countries.
Thank you. That's really helpful. And yeah, Julian and Anoushka, do you have thoughts of that in terms of the learning from your evaluations as well?
Yeah, I think one thing that really stood out to us was how the experiences of disparate provision from different agencies and sources that the children and families were reporting was very much kind of similar to staff's experiences, and this spanned barriers to kind of multi-agency working, but also right down to kind of at the well-established issues of different information systems not speaking to each other. So I think how we can more kind of efficiently work together, as well as have better resourced systems, I think is really important. And it's yeah, interesting to see that in both of these kind of programs, and also in the new evaluation Anoushka was talking about. You know, there is a real drive to try and address this. To try and enable whether it's kind of education, youth justice, or NHS and voluntary and community sector organisations, really trying to enable them to work together. But I think that an interesting point around the kind of having more funds and resources brings with it a kind of really common issue around the kind of stop-start nature of funding for some of these programs. I think with the Framework for Integrated Care Secure Stairs and for the Community FCAM services, uniquely these programs have been kind of continued, and we've seen how the Framework for Integrated Care model has been kind of adapted and applied elsewhere. Yeah, I think it's a real challenge when you set these resources up to bring these agencies together, and it takes such a long time, understandably, for them to be able to figure out how to work together. They get into a good rhythm, and then the funding goes because the project ends. So I think, yeah, there's kind of there's efficiency in working together, but also efficiency in how the funding's used beyond a kind of project basis.
Thank you. Yeah, that is it's a common problem, I think, across probably more of the talks than these capitalist seminars as well. That sort of time-bounded nature of this work, and just the sense that, yeah, it's very hard to sustain, isn't it? I did see a hand go up, but it seems to have gone down again. Was it? I'm probably going to pronounce your name wrong, I'm afraid. Was it Klaus? Did you have a question?
Yeah, I did have a question actually. So, I completely agree with everything that has been said, and I think I just wanted to understand some insights from like our speakers about like the child strategy plan that came in place on like the 5th of December, where the government announced some plans to lift children from poverty. For me, it was quite interesting how, for example, SN youth weren't mentioned at all. And I feel like that really shows how number one, like this topic is still overlooked, and number two, youth violence was not also mentioned. And I think it is very important that these are mentioned in the child poverty strategy, especially because they are core components. Yeah, and I just kind of wanted to hear like what do the speakers think and like what's their position, if that's okay.
Thank you. Yeah, that's a great question. When we're talking about joining up policy at the policy level and thinking through the implications if we move one lever, yeah, what does that mean for others, and how are we making sure we think it through in the round? It's a really good question. Susana, do you want to speak to that one first?
I can just make a comment on that, because this is something really close to my heart that I have been advocating for in various platforms, which is this idea that early childhood intervention, if it's in place and if it's in place effectively, and if it's following the theory of decades of research that we have on early childhood intervention, it's not just for children who seem to have some sort of special educational needs. It's for everyone and for every child that may be going through circumstances that are distressful in any form, in any shape or form. And so in some other jurisdictions, and some of them not very far from us, actually. So if we look at the definition of additional support needs in Scotland, for example, it's a lot broader. And so when early intervention is in place for children who may have a special educational needs or may be at risk of developing special educational needs because they live in poverty, when such definition and eligibility processes are in place, it's a step forward in addressing the poverty issue, and in my view, absolutely essential. And any early childhood intervention measure that is put in place without addressing that broad definition and eligibility criteria will not resolve the SEND crisis or the poverty crisis, really.
Thanks, Susana. Yeah, really clear point. Julian, did you want to speak to that as well?
Yeah, I was just thinking, I think in kind of projects and research projects, I think we do see kind of attempts in the kind of youth crime and violence work to take a more social determinants perspective in providing kind of prevention, early intervention, and support programs. So there's some work that we're involved with about how kind of trying to alleviate poverty might help with these kind of longer term outcomes for children and families. So yeah, I think it's really it's really hard to disaggregate these kind of closely interconnected issues. And I think there's obviously then the kind of access to opportunities and resources, not only for kind of education, but for employment training and to develop that kind of pro-social identity to help kind of enable young people to have access to development pathways that are fit for young people with a diverse range of needs, which we see as kind of something that's such a common barrier to people, and we hear a lot about how there's then the overlaps with becoming involved in youth crime and violence. So yeah, I agree. I think it's really hard to kind of unpick some of these issues.
Yeah, thank you. Yeah, thinking across what you both said, it sort of reminds me of the point of, partly the win with prevention is to change course before the problem escalates, but also when we're looking from a social determinants perspective, a lot of those levers are a win for many outcomes. And if we start too far down the journey, focusing just on one outcome at a time, it can be a bit of a sort of a whack-a-mole situation where we're trying to deal with the kind of the end game situation for each young person, which might look different, but really a lot of the causes are common. And if we could focus on those, we might increase gains, not just for one outcome, but for many, absolutely. I just seen a comment in the chat from Julia, which I don't think has a question, but it's just an interesting reflection. She says, I'm struck by someone quoting the 1978 Warnock report in their evidence, a great reminder that many of the excellent recommendations that have been highlighted by the brilliant research you presented today has been made for decades, not a question, but an observation. Yeah, I mean, I suppose maybe I can turn that into a question. I mean, I think we can often feel a bit like a bit of a stuck record, can't we, in some of these fields that we're dealing with the same themes, but unfortunately don't feel like we're making much headway. I mean, yeah, Susana, I suppose it was you that quoted that. Is that sort of is that a feeling you have? Do you feel like we've made progress? Do you feel like the same challenges are still true now, and the same recommendations perhaps have not been paid attention to, or have we learned some things along the way?
I think the last few years in England have been particularly damaging for most of the public services, and I don't think I'm saying anything new if I state that very clearly. I'm, as you can probably tell, I'm not from England. I have a very international profile. I lived in many countries before I came to England, but I have been living here for nearly 14 years, and so I saw when the Children and Families Act was introduced, myself and my team, we were very interested in some of the changes that in theory looked really, really well aligned with international recommendations for SEND and neurodivergence and disability in general. But we did write, and that's available and publicly available, we did write and warn about some of the challenges that would pose, and including some challenges relating to unfair allocation of resources if we didn't implement that legislation alongside very clear systems to define need, for example, alongside very comprehensive and embedded training. So a lot of those things were said back in the day when the Children and Families Act was introduced. That wasn't heard. And things just moved on without any consideration for the processes. So when I was talking about my grant, my project where we're looking at international policy, it's not enough to just look at the policies and regulate. We need to think about the processes that are triggered by those policies. And I think what policy making has forgotten over the last maybe 12 or 13 years was that element of really thinking strategically about the processes involved, because that's what's going to influence the output, the public opinion, and the experience of the end users. It does seem now that we've reached the point where everyone is saying the same thing. So I hear the same recommendations across research, the same complaints, and the same, and I have the same discussions across many platforms. So I am hopeful that some at least of these recommendations might be considered moving forward. But I agree, it is very frustrating to look back and see that so many things could have been actioned over the past 10, 12, 13 years, and they were just completely forgotten.
Yeah, let's try and be hopeful, but does feel quite intractable at times, doesn't it? Right, I can see more questions coming. So, Niran, did you want to ask your question?
Can't hear me? Now you can hear
I
me,
can hear you now.
Thanks to the speakers. Both those talks were fantastic. I've got a question around, so I think to Susana. When you were doing your work comparing across different jurisdictions, I was quite intrigued by one of the finding that came out around policies that with schooling policies around belonging, well-being, and diversity. Did you look at how schooling systems are judged across the different jurisdictions in terms of the outcomes they set out to achieve, kind of universally, and the impact that has on SEND experiences?
That's a really good question. Thank you. And I know that my funders have been asking me insistently to focus on outcomes in the different countries. We have been a lot more interested since the beginning in the lived experiences of the end users. So that has been, much more the focus of our research. It is very difficult to compare outcomes across countries. We did look at some PISA data, for example, but there's a lot of criticisms around what that data can really reflect. And so I don't think we can rely very much on it to compare in terms of attainment and engagement and attendance and other outcomes. So we are focusing a lot more on, and also there aren't databases in every jurisdiction, as we have in England, for example, that follow the children and track different outcomes. So it's very difficult to make that comparison. What we did observe was that in jurisdictions where there is, for example, a clear and explicit and standalone policy for inclusion, that defines inclusion not just as presumption of mainstream, but as a sense of belonging, thriving, well-being, promoting school attendance for the joy of attending school, not just for ticking boxes and having the scores at the end of the day. So those countries had much less school exclusion and a lot more positive experiences of the system. Mind you, there are negative experiences of the SEND system in every single jurisdiction that we looked at. And I think it's important to say that we are never going to reach a point where we say, oh, the system is great now, it's perfect. No, that would be desirable, because this is not rocket science. So we are constantly evolving and learning from adapting the system continuously. But what we did see was that, for example, in England, that was the country where in our evidence review, we did a systematic review in addition to primary data collection, which is finalized now, the systematic review. we didn't have we didn't have many at all positive experiences of the system, especially from the point of view of the parents. While in jurisdictions like Scotland and Finland, and I'm sorry I have to talk about Finland, we always do when we're comparing sense systems, but it's just the way it is. There were a lot more positive experiences, specifically mentioning that culture of belonging and the role that families play in working together with the school, the interaction between the school and the family. So that's what we can talk about. We don't have data on more specific hard outcomes, but we do have those that data around experiences, and particular experiences around school family connection and culture of belonging.
Thank you. I think that's such a crucial point. And I do see a lot more of that language coming out of DFE now. It'd be interesting to see what happens in the future. Well, as we've been talking about Finland, I think it's only right we come to Essie for a question, which will probably be our last question now. Over to you, Essie.
Just a very, very quick one. Thank you very much for two absolutely brilliant and really fascinating talks. I'm just wondering whether this is also an area where, this frustration or sense that, okay, well, we know what ought to be good, and yet we keep constantly asking for it. I wonder to what extent there is also a bit of a mixture of, because of the nature of the population, this population is perhaps less well equipped to advocate for themselves than some other populations. So when you are in a country that doesn't necessarily have a very strong social security network, or if that is in a flux, these may be the people who then get knocked off the perch first, as it were, in a limited resource environment. And then there is a sort of with the sort of the behavioral aspects of this, the sort of the problem behaviors aspect of it, it's also something that is harder to elicit sympathy for than some of the other conditions. And I wonder whether, to what extent we would do well to try and integrate systematic research and thought into those aspects as well, into going forward and trying to keep these individuals in the map. Because I do feel that given the degree of need and given the actual impact at a societal level, these kids tend to get disproportionately little resources. So this sort of idea of how do we best advocate for them, given that there is perhaps less ability to do that from the families, and given that the behaviors themselves can at times be so off-putting that they switch people off. I think those are real challenges if we don't want to repeat this cycle of these children always falling off the radar.
Yeah, thanks, Essie. I think that's a really helpful point to raise. I don't know, but perhaps, Julian, I'll come to you on this one because I know Youth Voice is a big part of your work too.
Yeah, thank you. I think, I think you're absolutely right. How we can advocate for children and families. I think there is kind of interesting work in policy about how we can kind of change the language we're using that is avoiding a kind of over adultification of children involved in the criminal justice system. I think the question of, do we already know what works is really interesting, tying into what Susana was saying. A lot of the focus is can be around kind of managing risk and kind of I think kind of putting a lid or containing the behavior rather than providing kind of support for children with those types of behavior. So I think there is a kind of really interesting sort of contradiction, and we're starting a study again in forensic CAMHS settings, which is testing out a kind of mentalization based treatment for young people with conduct difficulties, with difficulties around aggression and violence. So yeah, I think how we can kind of advocate for them, implement what we already know works, but also make sure we are supporting them rather than just kind of managing them.
Thanks, Julian. Susana, did you have any reflections to add to that too?
I just completely agree with Julian. Absolutely, this is what we see. It's needed, and it takes me back to my point around professional development. The professional development that we need is not more about types of send. It's not more, about the diagnosis itself. It's quite easy to get training on that these days, but it's about how do you promote inclusive practice? How do you become an inclusive practitioner? And how do you provide that support? And that comes with communities of practice, with talking to each other in the context and looking at the children as they behave in their everyday life environment, and looking at what supports can be provided there in that specific context. So that's the sort of professional development that I'd like to see implemented. It's more difficult. It's not as straightforward as delivering a workshop, but evidence shows that it can be a lot more effective for the sort of outcomes that we're looking at: belonging, well-being, feeling included.
Thank you, Susana. I think that is such an important distinction. We can feel like we tick the box on, like you were saying before, training or development, but it's really got to be the right kind of development if it's going to work. And it's, yeah, like you said, it's not rocket science in many ways. We are talking about what a very human need to feel connected and like you belong, and to get good support and good recognition. So yeah, probably that's a good point to. Oh, sorry, Anoushka, I can see your hand up. Do jump in.
Sorry, could I just add one final thought? I know we're pretty short on time. Just to say, I agree with Susana and Julian. And one more thing I'd like to add in relation to what Essie asked about: how do we talk about, or how do we advocate for this group of children and young people, when sometimes the reality is it might be a bit off-putting when we think about this cohort. Something I was really struck by on one of our other similar projects was the way that we were defining these children and young people was facing in complex situations or facing violence. And then we spoke to our young people's advisory group and we said, is this what we should be saying? Do you think this is the right way we describe this group of children? And they came up with some wording which was more around they're navigating adversities and they're facing social challenges. So there's also, I think we should also create some space to talk to other young people and ask them, how should we define this group? Do you think we're capturing them accurately? And I think that can also help in, maybe the language not being so off-putting, and maybe us not forming these maybe like biases around this group. So just wanted to add that.
Thank you, Anoushka. That's a good reminder as well that we are in a good position to create spaces and give a platform for young people to use their voice in that way in our research and our other work. Right, we have hit 1/4 past, but thank you for such a lively discussion, and thanks for really, really interesting and thought-provoking talks. Patrizia has put in the chat the details of the next Catalyst seminar in January, so hopefully we'll see you for that one in 2026. But in the meantime, have a great winter break and a happy new year. And thank you for joining us.
Thank you.
Thanks, everyone.
Bye.
Bye.
Thanks, everyone.